Hey, Dr. Vias, how are you?
Great. How are you?
I'm good. I wanted to bring you in for a little coffee chat because I'm curious about a few things. Can you help me out?
Of course.
One, does anybody ever ask you if you have a favorite procedure that you like to do?
Yeah, so one of my favorite procedures is breast augmentation. And I think the reason why is it really helps achieve harmony, balance, proportion. Everyone has a different aesthetic ideal. And so, some people want to go bigger, some people want to go smaller, some want a breast lift to position the nipple better. But ultimately, it's really up to what instills more confidence in you. And it's the same you, just, different.
Improved
So,
in some ways.
in
More
some
aligned.
ways. Yes, more aligned with identity, self-expression. And so I think that's the most important part of the consultation, is really understanding goals and ideals of beauty. And that is different for everyone. But, the breast augmentation historically can be done with implants. It can be done with your own fat, borrowing through liposuction fat in other parts of the body. And so you get the benefit of the donor site being improved, where you're borrowing the fat from and then, grafting it into the breast to improve the shape. Now, with the fat grafting or the fat transfer, really it's about not really building a breast in terms of like multiple cup sizes different. And the reason why is because it resorbs and not all of it stays.
Can you talk a little more about reabsorption? Because something that I find is a common question is, how long is something going to last? Is it going to be a forever thing? And, we're always hearing when it comes to fat grafting, which is something that you do so well, we're always worried about how much of it is going to last or how much of it is going to reabsorb. So for you, what are your findings?
Yeah, so I did my PhD in fat grafting and safety in breast cancer reconstruction and in breast aesthetics. So it's a topic that's deeply passionate of mine. And really, I was looking at that exact thing, which was, why does the fat not all survive? And the reason why is because it's a graft. You're borrowing it from one place, putting it in another, and it has to really live through nearby oxygen and nutrient supply. And because it doesn't have a defined blood flow going to it that keeps it alive, like a flap would or borrowed tissue from some other place of the body, it kind of just has to survive by what's called imbibition or diffusion. And so there's variable retention, variable resorption. Some of it will live, some of it won't. About 50 to 70% should stay. And that means that, it's a little bit unpredictable, but there are tons of benefits, because obviously you get improvement where you're borrowing it from, and then it's your own tissue. So it's not like an artificial filler. It responds to your body. So if you gain weight, it will respond appropriately. And if you lose weight, it would respond appropriately as well. So the fact that, it's your own body means that you don't have as high risk of things like infection or foreign body reaction or other things.
Is there anything that we can do as patients to better the possibilities of retention?
Yeah, that's a great question too. So another area of my research was looking at those factors as well. So what we know is that there may be variability. It's a very, kind of complex topic, but there may be variability in like donor sites, or even as we age, the fat responds differently. But one sensitive area that you can change is weight. And so like your body mass index, or your basically your weight in proportion to your height, that can change the quality of the fat. And so interestingly, even after massive weight loss, the fat cells remember where they came from. And so the fat kind of responds appropriately. So lean individuals tend to have better fat quality, better retention.
Interesting. Okay. So at breast surgery group, something that we're so well known for is breast reconstruction. So typically reductions. You're saying augmentations are some of your favorite procedures because of the immediate effects that it has on a patient's confidence, and the results can be almost immediate, right? So what are some other things that you offer or recommend here at the practice that you do?
in addition to, breast augmentation, breast reductions, breast lifts, sometimes these aren't in isolation. For example, with a breast reduction, you're getting a lift at the same time. With a breast augmentation, sometimes the augmentation is enough that you don't need a lift per se, but sometimes you have to have a lift in addition to the augmentation. So it's really up to the individual's anatomy and their goals. Augmenting or making something bigger and then also lifting are kind of two competing dynamic forces. So those are a little bit more complicated in terms of trying to get a perfect aesthetic result in one surgery. And sometimes it's achievable and sometimes it requires, an additional surgery to get it in a perfect position. But as long as people, kind of realize that may be a factor of, multiple procedures. Sometimes people want a little more fat added to the upper pole or for more cleavage, just to kind of like blend in the appearance of the implant. So they're all very interchangeable, and it really depends on your goals.
But do you want to do anything other than breast-related reconstructive work?
Yeah, absolutely. So I did 2 aesthetic surgery fellowships, one in New York City and then one at Mass General Hospital at Harvard in Boston. And so I really, really love everything aesthetic, really head to toe. But, often a lot of people come in thinking one thing may bother them, but then, I really focus on what bothers the patient, and whatever they want to bring up and discuss is what the focus of the conversation is. Now, sometimes they bring up other issues either at the same time or even after they've recovered from that procedure. And often, with breast aesthetics, they may be interested in something with their arms, like a brachioplasty, for example, or an arm lift. Or, sometimes people are bothered by their eyelids or the appearance of their brows. And so, oftentimes, some of these things are blend together or create more harmony. And, I think it has to be an open conversation with your surgeon to know your goals.
Definitely. I mean, I've had enough plastic surgery to know that when I'm giving someone advice and I'm talking to, if it's a patient or a friend, regardless, I'm always saying, think about what you already love about yourself. And then think about what you absolutely don't want in a result, right?